the management of acute appendicitis, diagnosis, treatment decisions, and post-operative care. Welcome to today's episode, where we'll be exploring the management of acute appendicitis, a condition that remains the most common surgical emergency worldwide. In this podcast, we'll guide you through the essentials of diagnosis, review the current treatment strategies, and offer insights into post-operative care. The landscape of appendicitis management has evolved significantly over the years, moving from an exclusively surgical approach to incorporating non-surgical options for selected patients. Our primary objectives are to resolve inflammation, prevent serious complications such as perforation and infection of the abdominal lining, and restore patient well-being. Initial assessment and diagnosis. Let's begin with the initial assessment and diagnosis. The first step in managing acute appendicitis is making an accurate diagnosis. This process starts with a thorough medical history and physical examination. Classic symptoms include pain that starts near the center of the abdomen and then moves to the lower right side, along with loss of appetite, nausea, and vomiting. Signs on examination can include tenderness in the lower right part of the abdomen, especially over a specific area known as McBurney's point. In severe cases, you might notice guarding or rigidity, which can suggest a more advanced infection. There are also some special signs, such as Rovsing's, psoas, and obturator signs, though their usefulness in diagnosis can vary. Laboratory investigations play a crucial role. A full blood count often reveals an elevated number of white blood cells, while C-reactive protein levels are typically raised and may even be more sensitive than white cell counts. Imaging is central to diagnosis. Ultrasound scanning is often the first choice, particularly for children and young women, as it is quick, does not involve radiation, and is useful for ruling out other conditions. In adults, computed tomography scanning is considered the gold standard due to its high sensitivity and specificity. Magnetic resonance imaging is increasingly used in pregnant women to avoid exposure to radiation, while clinical scoring systems such as the Alvarado score are sometimes used to assess risk. Imaging studies have largely taken precedence. Treatment strategies. When it comes to treatment, the approach depends on whether the appendicitis is uncomplicated or complicated. Uncomplicated appendicitis is characterized by an inflamed appendix without perforation, tissue death, or abscess formation. Complicated cases involve perforation, tissue death, abscess, or infection of the abdominal lining. For uncomplicated appendicitis, there are two main options: antibiotic therapy or surgical removal of the appendix. Antibiotic therapy, sometimes called non-operative management, has gained acceptance in selected cases. Studies have shown that antibiotics alone can resolve the initial episode in most patients. The usual protocol involves starting with antibiotics given in the hospital, followed by a course of oral antibiotics at home, typically for about a week to 10 days. The advantages of this approach include avoiding surgery and its associated risks, as well as avoiding surgical scars. However, there are drawbacks. The main concern is recurrence, with about 20 to 30% of patients experiencing another episode within a year. Some patients may not respond to antibiotics and require surgery, and there is a small risk of missing underlying conditions, such as an appendix tumor, that would only be detected if the appendix were removed and examined. Surgical removal of the appendix, known as an appendectomy, has been the gold standard for more than a century. The preferred method today is laparoscopic surgery, which involves small incisions and the use of a camera. This technique offers several advantages, including less pain after surgery, a shorter hospital stay, quicker return to normal activities, and better visualization of the abdominal cavity. However, it requires specialized equipment and expertise. In some cases, an open approach may be used, which involves a single larger incision. This may be necessary if laparoscopic equipment is unavailable, in cases of widespread infection with patient instability, or if the patient has other medical conditions that make the laparoscopic approach unsuitable. In complicated appendicitis, the patient is given fluids intravenously and started on broad-spectrum antibiotics. Urgent surgical removal of the appendix is usually performed to eliminate the source of infection and clean the abdominal cavity. In cases where there is a well-defined abscess and the patient is stable, image-guided drainage may be performed first, followed by antibiotics. Surgery to remove the appendix can then be scheduled several weeks later, which avoids operating in a highly inflamed area and reduces surgical risks. Ultimately, The choice between non-operative management and surgery is a shared decision between the patient and the surgeon, weighing the risks and benefits for each individual. Post-operative care and complications after surgery. Care depends on the severity of the appendicitis. For uncomplicated cases, patients are often allowed to drink clear fluids within hours of surgery and may be discharged within 1 to 2 days after laparoscopic surgery, or 2 to 4 days after an open procedure. Pain is typically managed with oral medications. In complicated cases, a longer hospital stay is necessary, with continued intravenous antibiotics, gradual progression of diet, and careful monitoring for complications. Some possible complications after appendectomy include infection at the surgical site, which is more common with open surgery, collections of pus in the abdomen, which may require drainage, temporary paralysis of the bowel, bleeding, and rare injuries to surrounding organs. In laparoscopic surgery, there is also a risk of hernia at the port site. Summary and key takeaways to summarize. The key to successful management of acute appendicitis is accurate diagnosis, relying on clinical judgment and supported by imaging studies. Patients with uncomplicated appendicitis now have options, with laparoscopic surgery providing definitive treatment and non-operative management with antibiotics offering a safe alternative but with a notable risk of recurrence. For complicated appendicitis, urgent surgical intervention remains the standard, except in stable patients with a defined abscess, where drainage and delayed surgery may be appropriate. The best management strategy is individualized, considering the patient's clinical condition, the expertise of the surgical team, and the patient's informed preferences. As research continues and more long-term data becomes available, guidelines for the management of acute appendicitis will continue to evolve. Thank you for joining us in this in-depth discussion. Stay tuned for more episodes where we break down important topics in medicine and surgery. If you enjoy our content, please like, share and hit the subscribe button. It's the Everything Surgery Podcast. Dissect the extraordinary.